Good morning again. Welcome to our discussion segment in Good Morning, Anambra. This morning, I want to apologize for keeping you waiting because we ought to have been here before now. Do forgive us, please. My name is Ijoma Uche. I'm here with Ebere as my co-presenter. Ebere Gunda.
Yes, good morning to you, IJ. It's a very windy Tuesday morning. How you doing?
I'm cool, very cool.
I can see you're really cool.
Yeah, as usual.
To go, right?
Well, now, trust me. Okay, yeah, and we have a very important topic to talk about this morning. It is disease outbreak. WHO declares monkeypox global health emergency. Disease outbreak, WHO declares monkeypox global health emergency. That's exactly what we're going to look at today. And when we have a topic like this, you know exactly who is going to be here to talk about it. It is the people in charge of our health. That's why we have invited Dr. Afam Obidike, Honorable Commissioner for Health, Anambra State, to come and join us in this program this morning. Welcome, Doc.
Thank you so much. Thank you so much.
And we have another person that's joined us too.
Yes, we also have another guest in the house, Dr. Chuma Imimbolu. He is the state epidemiologist. Good to have you on the show.
Good morning.
Good morning. And of course, Dr. Afam Obidike, the Commissioner for Health. He prefers we call him Mr. Commissioner. Good to have you on the show again.
Yeah,
just like his principal, Mr. Governor, and his commissioners. Okay, you're welcome, sir. Well, you have heard the topic we are looking at this morning. And I don't know, it's so scary when you talk of this epidemics. Okay, but now I want you to tell us first of all, what is this monkeypox?
Yeah, thank you so much. It's a very important topic to discuss, especially now in the state that we are beginning to have one or two cases over there, and we recorded our first case last month, 29th of June, and when we talk about it, it's just a zoonotic disease, you know, that you get from eat of the zoonotic animals like rats and the monkey. And this also could be transmitted through human to human transmission, but human to human transmission can actually not sustain the transmission of this disease. That's the truth. So we still want to emphasize on people that consume the bushmeat, as we discussed, which could actually one of the things linked to that. And when having it, the good news is this. The fatality case is not as the case fatality as the people that die from it or complication we get from that. It's not that so bad in the state. But however, so some of the we have had some cases of it that actually has resolved. We have been treated. But how do you know you're having this symptom, have this case? That's the thing. You know, monkeypox,
Before we get to the symptom, monkeypox, when you hear that, what comes to mind is chicken pox, okay? And then you now talked about monkey and the rats being source of, contacting this. How do we differentiate chicken pox from monkeypox?
Yeah, very good question. One is this, when you come out there, you check out the rash, the pattern of rash you see in the monkeypox and the chicken pox. But however, we in the States have said when you are having rashes, which is in the second phase of the skin eruption of the disease, you should be able to come to the hospital. We can see and differentiate the pattern of presentation of the rashes. In addition to that, we must take sample and send to the laboratory, molecular laboratory, in order to diagnose it. So the slogan is this: if you have rash, you should come to our health facilities. It is on us that we put you on a holding. Almost all the health facilities in the States, we have had what we call a holding center or an isolation center, where when you have this, you will be there in order to prevent or limit the contact you have with others On them, we take your sample, and good enough, Anambra State is one of the states that have a very quick turnaround time for the investigation, because only one place they do this investigation in the country as we speak, Abuja. So, but when we do that with the help of the DSNOs and my epidemiologists, hardworking epidemiologists, we have been streamlined to get the sample, and our turnaround time, that's the time we send the test and the time the result comes, has actually been very, very impressive. So that has been very helpful in us in managing this disease, and also limiting isolation, unwarranted isolation, because sometimes when you have rash, as you speak, it's good that you mention this rash, and a lot of things it could be allergy. A lot of things could be a cause of a rash in the body, but we have a pattern of this particular rash, has a pattern. But in order not to tell our viewers that you have it, just come to the hospital. Our health personnel have been trained on distinguishing it, and in addition, the confirmatory result is
I hope
taking
it's not like what we're seeing in the...
Yes, it is actually. It is actually. We have some preference that we came with.
This one is almost boys now.
Yeah, you see pulse at the tip of it, but it's actually the funny thing about it is this: the after effects of it, because in the management of it we have inculcated what we call the psychological effect on management of it. So I was thinking about, how do you know you're having these rashes? You know, you have the invading phase and the skin eruption phase, which takes like average period is 6 to 16 days. So, but when you have the first phase, where you have the first phase of it, when you have the patient will be having fever, exactly. That is the pamphlet we have got in conjunction with WHO. We circulate it to the health sectors so that they're able to see. Most of our health sector, health facilities, if you enter in there, you see the big poster we pasted on that. But when it's occurred, when our governor, Professor Soludo, mandated us to make this thing known to the public, and also how to prevent it, and also educate people on that. So with conjunction of WHO and the NCDC, we're able to produce this in thousands, which we continue to produce to give it out to the public, so that when you notice all these things, you'll be able to come to the hospital, and the doctors there will examine you and also take the samples.
All right, let me come to you now, Dr. Chuma, as an epidemiologist, talking about this monkeypox. How would you say, it has actually affected Anambra, Nigeria in general? Because it looks as if it's still just creeping in, or is it something that's actually, blown,
out of proportion? No, it hasn't been blown out of proportion. Before it was declared a public health emergency of international concern, it was endemic in West Africa and Central Africa, especially in Nigeria. Yeah. Like the index case they had in UK for this major outbreak was a traveler that came from Nigeria to UK. So it has been with us. Okay. Yes. So the issue about monkeypox and this thing that is misdiagnosed, and a lot of contact trace has not been done. So cases have not been picked up. So now the international community is involved. You will see a lot of cases now. Like currently in Anambra State, we have 4 cases, 4 positive cases, confirmed cases. They're all confirmed cases.
Has it grown to that stage we saw on the TV now?
Yes, one with the first case we had is the lesions. The pattern of lesion in chickenpox and in monkeypox, the spread, it starts, how the symptom presents. The major difference between it and chickenpox is the pattern of rash distribution. It starts from the head down. Then the lesions are much wider.
When you say lesion, you mean the size?
The size, the size
of the rash.
Okay.
Now, the lesion means the rash.
The rash
that's
itself.
what we mean by the lesion. And they are uniform.
They are uniform.
Mainly. Yeah. So, but the issue is that because there is differential diagnosis when you have rashes. So that's why we say you come to the hospital. Because we won't want people to stay at home and presume
that this is this or
this is that. Exactly. Because a lot of things can give you rashes. A lot. Allergy, chickenpox, monkeypox, a lot of things, but you come to the hospital, the health facility personnel that have been trained on that, and also you get confirmatory results too, and also the pattern of each presentation. Like now, if you are somebody that enter where there's flour, you start having some urticaria rashes, you know, and there's someone that have been having fever, headache, and you have history of contact with someone that has had rashes, or you have been consuming a particular rat and the monkey or all that, and also you are coming from a place where you are having it in high concentration, so and you start having rashes from the history, you start saying this is this, and between 0 to 5 days or the second phase of it, after this skin fever and headache and all that, you start having the skin eruption, which is you know that probably this is that. But we have the health personnel that are being trained and also been to, because this is, you know, training and retraining.
Okay, but you said that the cases you've had, one or two cases?
In Anambra State? No. We had our first case, 29th. Also, it's good to also appreciate the management of Nnamdi Azikiwe University Teaching Hospital, Professor Joe Ubaja and the team. We have been working together, closely together on this. The first case has been discharged. Second case has been discharged.
How long did it take?
Mainly within 21 days or less than that, the infective phase is gone, and they were discharged. Only that the rashes. The rashes
don't heal. You still see the spots, just like a monkeypox.
Just like chicken.
Just like chicken pox, you still see the spots. You see the marks.
How long does it take before the spots clears out?
That is where we now talk about the psychological effect in trying to discuss, you know, the effect of it. It could take some longer to clear. So that's why you need to, because you see somebody having these rashes and the spots in the body and all that, you know, you need to we are trying to involve the psychological aspect of this.
But I still have some chicken pox on my legs now, so it may not really go actually.
Yeah.
But the one I had is still
yeah, but nice on the leg, but this one starts from the face down.
So are there cases where it may not even go at all?
No, the spots should go, but what you say, it won't heal completely, just like it won't complete gone. Let's start applying different cream and all those things, just start having reactions.
Okay, so you don't start having, you know, this psychological problem that, oh, is it the way I'm going to look after this? So just forget the important things that you are alive. I want to ask you something. Apart from, okay, the major sources where you get the syphilis from rats or the monkeys, and then you say if somebody has contacted, the person will be isolated. So how can I contact it with somebody that is already having it? I have not eaten any monkey or rats, and then I'm staying close to the person that has it, just like chickenpox.
Yes,
so
you have asked a very good question.
The droplets.
Now, when you look at it, the households where people have this, and also the households and also health workers are at high risk of this disease. It's even as happened in UK. So, and the same thing. So what happened is this: if you are close to the person, droplets, because you can hear it. That's why the issue of in a close contact, person should wear face mask or you give a distance. Because if there's a droplet from the infected person to you, you will definitely get it. Then also the pulse vesicles, when you get in contact with another person, it's a source of it. So that's why the health workers are at high risk. And in the States, we try to provide preventive mechanisms, equipment in other people will wear to at least level 1 or 2, because it's not that as contagious as what was it called, COVID.
Really?
COVID, yeah. But we try to protect our health workers, especially while managing this thing. When you wear protective equipment and all that to prevent the vesicles contacting to the person.
Hello, good morning.
It's gone.
All right, still talking about this monkeypox disease. Let me ask you, Dr. Chuma, why do you think the WHO now is declaring it as a global emergency?
Because now it has spread to other countries. Now it's a global thing. That's why they declared the public health of international concern. because now it has, from one country, if the cases, you have over 2,900 cases in the UK, in the United States, there are 3,100 cases, confirmed cases in the United Kingdom, then 2,900 cases in the US. Then you have scattered cases around Europe and Central America. So now, before it was just in Africa, because there was an issue then before they declared, because this thing was declared on the 23rd of July. So before then, they had a series of meetings. So this is the highest level of declaration by WHO. When you declare something public health emergency of international concern, it's the highest level. Because after then, because there's something called the international health regulation. So after meeting, they have to do a risk assessment, and when they see that, because when you declare things like this, because you're traveling from one country to another, you're crossing borders. So you have to, when you declare this, you're not put everybody on alert. So every country now is on alert mode, because you have different modes. So the emergency operations center, you have different modes. So we're now on alert mode now, all over the country.
Hello, good morning. All right, please, as much as possible, when you call us, please move away from your TV set, or better still, we can tone down the volume of your TV set so we can, hear you very clearly right here in the studios. So you were saying something.
Okay. So when you declare something like every country is now on alert, the WHO member countries, they're all on alert. So you're now watching for cases. So when you now come, when people have symptoms of you prevent them from traveling, you now put preventive measures. You now escalate it. You now put you now release funds. So you now try to mitigate the effects. They're over in Europe, they say it's common in homosexuals and bisexuals. Okay. That's
where you actually contract this monkeypox.
That is but you can contract, like now, if I'm assuming I'm positive of monkeypox, yeah. Then you have close contact with me without putting on gloves and everything. You touch the fluid.
Okay.
You're just like chickenpox, you're likely to get it. Okay. They are the same family, almost in the same family. It's an orthopox virus.
I was going to ask one question. Let me ask the Commissioner for Health. Still in this mode of transmission, is there a particular, now it's called monkeypox, is there this particular, consumables people actually consume, human beings consume that, leads to this contracting of this virus or this disease?
No, it's the mode of transmission, mainly one, zoonotic, two, human to human. That's the pure mode. And the human to human alone cannot actually sustain the transmission of this disease. There will be a breakdown. So it means that there's a reservoir, the animal reservoir, that keep on getting this to people. Then you mentioned about the sexual pattern of where it's high. It's also, we notice it here. The 4 cases, it's actually towards that more in homosexuals this thing. Yeah, it is. It is.
That one that you say that it's less lethal, the one that you get from human to human through homosexual acts.
It's not only human to human. If I get the vesicle, you touch it and you get it, it's also human to human.
Okay, but the one that from the homosexuals.
Yeah, it's still mostly because you have a strong contact during the procedure, so that could be explain the fact.
Because I read that now most cases they have outside here are dominant with the homosexuals.
Yeah, that's what I'm saying. Even here, the pattern is not different here. The 4 cases we have had, is tending towards that.
Really?
Yes, we're tending towards that.
This is scary.
No, it's not. It's not scary.
So how does it happen? How does it happen? The virus is domiciled through the
means most of them, some of them also, you see the rashes start from the genital areas.
Okay.
The genital area. So we're trying to, as the case presents, we're getting data on that. So actually, when we get a particular number, we can actually segregate and say, yes, actually, our pepper is the same with what is over there. But now it's like 50–75% related to what is over there. That's the truth. But that doesn't mean that other means of transmission is not
I
high.
know, but I think that one should be emphasized more,
Yes.
because I don't know how many people can afford what do you call this bushmeat. They are very expensive, except for those that eat ordinary rats. You know, the okay Belgian in the house. Otherwise, bushmeat is very expensive. So if this is a major source of contacting, it's scary.
Yeah, it's one of
the
the areas because those rats is a reservoir for that. They maintain the continuously this thing, transmission. And also, you know, people also in the villages and all that, they consume those things. And also, so it's there. But the good news is the issue is this: our case positivity is 80%, right? Meaning that in every 5% we test, 4 will turn out to be positive for thrush. Now, that's the truth. Then, but the issue is this: the case fatality is low. We have not 0%.
I was going to ask
probably
you.
what we are doing is okay too. Then there's a linkage between the people that have been immunized for smallpox has a protection to that, and that could be that, and also because there's no definite treatment to this. We should know that.
We are coming to treatment.
Yeah.
But before then, I think this is a very big issue. Perhaps that's why the WHO had declared monkeypox a global health emergency. Well, we'll have that declaration. We might need to show it to you now before we come back and then talk on the symptoms, signs and symptoms of this disease, and then what the commissioner is doing in the health sector to curtail this, since we have not registered any deaths. Okay.
In terms of outbreak response and surveillance and all other activities in the PSC revitalization sector. So far, since we had this case, two suspected cases, WHO has supported through the surveillance unit, state EPID as well as our own surveillance officer in the sample collection, as well as ensuring that the sample went to the lab. And then when we heard about the results, we are supporting the state also in terms of all the pillars, that is in the contact tracing, contact tracing for the case that we have. So this we are here to also cooperate with the state and ensure that we bring this outbreak to a stop, and also to make the public to be aware of all the prevention of how we protect ourselves and the Indians of the state.
Monkeypox is a disease that is a dangerous disease, an infectious disease. We have heard of it. Recently there is an outbreak in America and some part of Europe with casualties. And Africa is full of monkey. Definitely the infection must have been here and killing, but nobody is detecting it.
It's a dreaded disease that came in, but I don't think it's prevalent here. But I think I heard we have a case here in Anambra State. But I think the panacea is just neatness, being neat, taking care of everything, the same way we did when COVID and the rest of them were with us.
I know monkeypox is a viral disease. And I believe the only way, the much I know about it, is someone that has it definitely see visible rashes on the body. That is all I know about it.
Monkeypox, as much as I know, it looks like boil on the skins. They said it's being contaminated from monkey.
I've heard about monkeypox. Though it's something that is degenerating just in the world. Just like we have COVID-19 before now. Government needs to do something about it.
So what I'm saying is that people with any kind of symptom should go for test. Any kind of symptom at all, no matter how it looks like. I don't know, I cannot actually say this is how the monkeypox symptoms is like. But a pox is a pox, which means it has to come out on your body. You go for immediate test so that it can be contained once you have the symptoms.
Okay, welcome back. We are still looking at this all-important topic this morning. That is the disease outbreak. Well, WHO has declared monkeypox global health emergency, and we still have Dr. Afam Obidike, Commissioner for Health in Anambra State. That's Mr. Commissioner with us here, and with
Dr. Chuma Imimbolu, who is also the state epidemiologist.
Okay, welcome. This is Africa, though the disease may have started in America, but I I listened to one of the people who talked to. I said, this is Africa, and there's monkey everywhere. Okay, so that the thing might be on that we never knew. I may be killing people without us knowing that that's what's going on, but I don't think that's right. Okay, but let's continue. I said that when we come back, we'll talk about the signs and symptoms of this. Of course, the Honorable Commissioner wanted to start with that before we stop him. We can now go back to that now. What do you see, and you go to hospital to ask?
Yeah, thank you so much. You know, this monkeypox is more in the Central and the West Africa. Yeah, so the index case there was actually traced down from Nigeria. So yes, so so in UK it was from Nigeria. So that's the index case there, and also the one of the Central Africa is the fatality is more than the one we're having in West Africa.
So does it have different variants?
Yes, yes. So our
really?
our
like
own
COVID?
in the West Africa, yeah. The West African own is not as that fatal as the one of the Central Africa. Then, however, we mentioned about the incubation period. You could have 6 to 16 days. You know. Then what could we be having? Headache, rashes, muscle weakness, total weakness, and fever. Yeah, because we have a suspected case and definitive case in the destiny. We'll probably talk about that one, the state epidemiologist. However, when you come about the first, invading phase, that's when you start having this fever, intense fever, headache, weakness, and lack of, you unwell. Then you now enter the second phase of it, which is skin eruption, when you start having those rashes you see in your body. So in those cases, now when you start having those, you stress first for the safety of your household. Two, when you start having this, you go to the hospitals, and they say the health personnel is there. Then also in the hospital there will now be classified having being a suspected case. When you're having high fever, I have rashes and also have a weakness in the body then. So what they do in order to suspected case, now what we're going to do, by classifying your pattern of rash and the type of rash you're having. Then second, now to define your case, you need to collect sample and send to Abuja, where we do the
sample, the blood sample, or the rash sample. Where do you collect?
The vesicle, the site of the rash.
Okay.
You swab it and take it.
Okay.
The issue is that sometimes it can be painful, but we are trying to make it as painless as possible. Myself being a pain physician, so I will try to get modalities to make it as seamless and painless as possible, because I don't believe you get pain while treating patients. No, I don't believe in patients having to have pain while you want to treat the patient. No.
Adding insult to injury.
Yeah, that is actually my area of specialization. So now we want to we collect the sample, we send it to Abuja. At the point, we still get in isolation because we don't, a suspected case, so we don't want it to be sort of risk to people out there. Then on our healthcare personnel too, when they see such things, they get also careful and get themselves protected, because we don't want, one of the cases, 4 cases we have that positive, one of them is a healthcare personnel. That's the truth. So that's the risk we take in being in the field, and we appreciate our healthcare personnel in the state for their effort. And also, so when we do that, the issue is this. The good news is this: when the result comes out, and with the treatment we are giving patients, most of them get well.
I was going to ask this question because most times these diseases, when they do come or people contract this disease, and after a while they're healed or treated of these diseases, is it possible to get it again? Now, monkeypox. For those who have actually contracted it and got treatment and get better, can they contract monkeypox the second time?
I think you should answer that one.
Like, there's something called passive and innate immunity.
Active. Yeah.
Active, yes. So, when like, why monkeypox resurfaced again was, there was, the whole world was declared smallpox free in 1980. So monkeypox is from the same family with smallpox. So it's just like when you give a vaccine, when you vaccinate, like the gold standard, the gold treatment of monkeypox virus treatment is smallpox vaccination. Okay. Yes. So when someone gets infected, I don't think there will be a reinfection. There's no study that shows there will be any reinfection. Okay. Just like someone has chickenpox, there's no reinfection. Unless the person has a low immunity, they now have herpes zoster. It's just the same pattern. Okay. So like if someone is immunocompromised, and maybe the person has chickenpox prior to that period, maybe when the person was much younger, and the person has that thing, because it now follows the root dermatomes. That is, I'm going towards 10 to months. So it's the same thing with monkeypox. So when the person gets infected, there's no proven that the person gets reinfected again.
So once you get infected,
it looks never.
It's not never.
It's not never.
In the real sense of, they say smallpox. There's evidence that smallpox, people that get vaccinated smallpox are less likely to be infected. So that's why the thinking is now towards, could we use the smallpox vaccine in vaccination?
Okay,
yeah, so
don't have any vaccine yet for this. Yeah. Unlike other cases, COVID and other things, how are you treating the cases you have now?
Yeah, thank you so much. We say before we go on how you prevent it, because I always believe, even our governor believes in prevention of everything, both non-communicable disease or uncommunicable diseases. We always believe that people should be educated on ways to prevent this, because so now on the ways to prevent it, we still talk on that one, but on what we are doing on treatment of it, there is no treatment. We manage the case. Okay. You manage it. One, you manage, you're having a skin rash, somebody could have superimposed bacterial infection. You cover with widespread antibiotics. If the patient is having fever, you treat, and also treat any concomitant infection. Also, give IV fluid if the person is dehydrated and it's not, because when there's skin eruption, there is dehydration. So these are, you do supportive treatment and support the electrolytes of the person in order to keep the person as a whole. Okay, it phases off and the person gets okay. That's why I say there is no need to panic when you have this. You come to the hospital, you have the health facility. We are working closely with an infectious disease person at NIUT NEWI too. So that's why I appreciate the CMD of Nandazike University teaching up to Professor Joe Bada. We have been working closely. Yeah, so it's a management. In management, what we do in management, you take care of the whole system of the person. This is, you handle this, then you put something that will prevent the rashes, you prevent something that will prevent this bacterial infection, superimposed bacterial infection, because when your skin is erupted, you have the risk of having bacterial infection on that. If you are not eating dehydration or that fluid, we give IV fluid and also skin cream and all that will keep the person calm. So these are the supportive treatments we give, management care. That means we manage the person closely. Okay. Then in terms of the prevention, that's why we first, media they have a serious role to play in this. There's no way you talk about healthcare strengthening without talking about the information. And the information is you people, the media, we are saying. So educating people on this, that you want, when probably if I'm a father in the house, I have it, I should be able to self-isolate myself in the house in order not to put other people in the house at risk. I don't know whether you're understanding me. That is a very serious issue. That is the first. Then you go to the hospital to be open to your medical doctor that could, then we now isolate you. And when they're treating you, they will do that, not they will start a sort of insulting or or abstaining you. No, they will attend to you.
Stigmatizing.
Yeah, that's right what I'm trying to use. Not they will start stigmatizing you, no, but however, they will protect themselves in treating you because you're not the only one they're going to treat. If there's thousands of you, they should be alive and healthy to treat you. But when you're open to them, we have had incidents, cases from some people that will come, this will be diagnosed. They will know that I can't stay here. They will go. Yes, that's why I say that it's not their fault too. It's not the fault of the patient because we should have the human feelings to this. That's why we want to come in with the psychological aspect because it's difficult, like myself now, you now want to be in a room. Yes, but when you now try to tell the person, look at the reason why you are here. Look at the reason why you want to be here. You're not going to be here forever. We want you for the benefit of your own family. You stay there, and we understand that this is not comfortable for you. But we try to make it as conducive and as comfortable as it may be for you.
How long have you gone in that regard, the psychological part?
Yes.
A lot of people feel like, I'm just alone in this.
Yes, this is a very good question. We had a meeting on Sunday, right? Yes. We said we are going to, because we have a meeting of all the pillars, all the people that are involved in this, in the state, WHO, UNICEF, NCDC. We have meeting alternate day. WHO, UNICEF, and NCDC, and UNICEF, and the European Union. They have been very supportive. We will always have meeting every other day. Yes, we discussed extensively of this 2 days ago, of psychological involvement on this, and we are pretty soon going to inculcate it in the management of it because that is what the area we know that is even post-treatment, during treatment and post-treatment.
Okay.
Once in a while you call them to encourage them. Yeah. Especially when they're being isolated.
He does that a lot in the epidemiology unit.
You call, you have to encourage them, you have to ask them questions, I hope you're feeling better, all this. That's the psychological part because the person who asks you have to be open to a lot of questions.
Yes, because we know these things happen more in the Western world. Here in this part of the world, we don't really care about ourselves.
Treated like a garbage.
That's why I'm asking about that psychological part because, when someone feels alone, especially going through some kind of issues that regards to health, he just needs that, or he just needs
encouragement.
That,
we realize that in the not only in this monkeypox, we realize that it is going to be our core in the core of our healthcare reformation in the state. Well, that's the truth of the matter because if you're able to, as a doctor, we are equipped with information of what's wrong with it, but the patient is not. So if you're able to be open to the patient and also discuss with the patient and all that, we're going to work good enough. The state, we have a psychiatric hospital, but psychologist is the one we're looking at to involve in this. We're going to do, it's not going to be easy that we achieve it once, but we have started doing it 1, 2, 3, 4 places. But this one of the reform the governor is bringing into the health sector, Professor Soludo. He mentioned it about the psychological effect of every other thing we are doing in the health sector, and we are bringing it on board.
Oh well, I know you may not want to look or maybe answer this question I'm going to ask you now, but I still have to ask it. Because I know when we, at the onset of this COVID-19, we had a lot of issues trying to contain it. And after some time, some people came up with some local measures, some local therapies that one can use and, to be able to, douse the effect of COVID-19. Some people say you get dogonyaro, you boil it, you steam, you do this and other kind of a thing. Do we have anything like that concerning this monkeypox? Is there anything that we can rely on local basis, homemade treatments that, one, will prevent you from having monkeypox, and two, when you do, it will relieve the pains?
I thank you for that question, but, even though we're trying to inculcate herbal medicine and conventional medicine, but I won't advise, there's no proven home remedy for monkeypox yet. So I can't say go and do this because it's just like when you have fever. I'm going to tell you to go and take abo or something to use it because that might be affecting your liver because you don't know the dosage you're taking. Because when you have fever, because this is what you're treating in monkeypox are the symptoms. When the thing appears, you treat the symptoms. When you have fever, you take antipyretics. When you have rashes, you take when the rashes they are itching you, you take antihistamines. So then when the lesions now erupts, you take antibiotics. So this is, they are dosed. So if you now say, go and do this, go and rub charcoal, go and rub all these things, and this is so for it to dry up, you might even cause more harm.
Honorable Commissioner, you're smiling.
Yeah.
Any local therapy?
Yeah, we in the States, we appreciate the efforts of the herbal medicine. That's why we are trying to tell them, come together, let's see what you are doing, let's test what you are doing. We appreciate what they are doing. We have, yeah, even the artemisinin, you know, is herbal, is grown in the States. However, on this monkeypox thing, is actually, I'm sure they have not started talking on it because they are trying to monitor the environment. But what it means is this, the transmission is clear. The mode of transmission is clear. Prevention of this is the key to make it. One is that human to human transmission cannot sustain this. Meaning that if we're able to stop it at that level, genetic, fine. Two is this, if you, as you said, you could worsen the problem, because when you have the rashes and you go and rub something that is infectious, bacteria, you rub it on your skin, you become to have sepsis. And when you have sepsis...
What's sepsis?
It's severe infection, in the layman language, overwhelming infection. Bacterial infection, any infection.
Virus infection.
Yeah, so the person will now be overwhelmed. Look at what happened. Your skin, for instance, let me just explain it, is for protection. Your skin, because you could have anything coming out, but your skin, because it's intact, it protects it. But when you have a breach on it and you rub something that's infectious, the blood will absorb it and it becomes infectious in nature. So that's that.
I was going to ask this question because I think we'll be rounding off any moment from now. Let's talk about stigma. Now, monkeypox, and we know in the Western world it's really, really high there. And you've also talked about the fact that it's also linked to bisexuals. Now, there's a lot of people that practice this as their lifestyle and all of that. This issue of stigma with monkeypox and bisexual people.
Yeah, thank you so much. You know, we have not want to make this statement strong now. I said we are collecting data now.
Okay.
Yes, that's the truth. We are collecting data now, but there's a linkage. No problem. Yeah, but until we are done with our data, we you know, one of the things we do in the ministry now, health, that is in line with the agenda of the governor. It's all about sort of using data to drive your decisions you make, and also do ensure that you use data to speak. This is just new. We have just 5 cases now, 4 or 5 cases. We are trying to get data on the linkage to that, which we discussed about this data analysis on this particular area. Yes, day before yesterday. I said we're doing that. So until it comes out, but however, we actually, you know, there's a question you asked on what the government is doing, mainly to mitigate this, to reduce this, to do this, and it's very important to mention that, because that will make people to know more. One of them is this thing people are doing, and the media. I mentioned information, and people are doing well for that. I must appreciate you for that. Seriously, honestly, people are doing. The media is in healthcare, in healthcare strengthening, the 6 pillars. Information is one of the key areas.
Sure.
Yes, information. So, and I'm beginning to ask media to be more involved, because you are also doctors. We see, because it's the information, when you give the right information, and we give the information, and you people know how to pass the information to people, to the right people. Then, when you saw that video, then I was surprised people had it. It was the press release. We have the first
when we had the Phoenix case.
That's the state coordinator, Dr. Adamu there. We are working closely with them. What we have done was to first at least make the health facilities in the state, the healthcare providers, to know this, because this is new. This may be new to them, in the sense that they may not know what to do. We don't want them to panic. I was I'm a critical care physician. When COVID came, we were among the first that went to front line, and I know the anxiety, and we passed through. But now, what we try to do, educate them. You see, that will help them to reduce, that anxiety will reduce. They will be able to absorb the pressure that could be coming. Then, secondly, also the lab. People going to collect, what about if you go to collect the lab and the person will not hit you and touch you the thing. You'll be, so we have been able to speak, we have been able to train them with the WHO and UNICEF in the States. So and we have DSNOs in almost all the 21 local
in all the 21 local.
We have that like
Really?
Disease surveillance and notification officers.
Yes. So
for want of time now, is there any challenge? Any challenge so far?
Actually, for
manpower, finances, just talk about it.
You may not have it all in the healthcare system. But what matters is that an emergency don't knock on your door that they're coming. That is why when the governor, Professor Saludo, assumed office, when we came on board in April, we developed our emergency response preparedness team immediately because we want to use it to also get prepared for emergency, for flood, for any outbreak. It's one of the pillars of the 5 pillars of the agenda of government on health is preparation for emergencies. And that's one we're coming, emergencies, medical emergencies, accident emergencies, surgical emergencies. Probably next day we're going to talk on the one we're coming on board pretty soon on emergency medical services. We're coming on board in the state by God's state.
Wow.
It's going to be a game changer in the, in the health
Our health sector is really coming up very strong. And we're so happy about that. Talking about information before we go on a very lighter note, is sepsis, yeah. What can I for me in
Okay, sepsis will infection. The mother overwhelming, not the go infection, sepsis. Sepsis, okay, infection. Obviously, this is too much. And malaria, no. On boy, I'm the bees or the high. On moment, boy, the fever, the low. And if only on our cachetic, sepsis is the mortality is high.
Really? It leads to shock, septic shock.
Yeah, septic shock. You can't get your BP, you can't get your pulse. Septic shock is one of the major things in
that is the thing. Exactly no MSc na lecture because now
so that is it. So it's something that, and the most times most children that die is because of severe sepsis.
What leads to that sepsis?
Infection, you can, like what I have said, bacteria superimpose. Like you have this viral infection, right? Yeah. Yes. Then this one will superimpose bacterial infection on the person due to what?
Using all those things like you asked about those herbal things. Using things you mix. You know this is the mix.
It's not sterile. Like no, actually make the surgery. Sorry, actually remember the surgery, not you. You sterilize the equipment in order not to introduce infection.
Okay.
So those things are better in a sterile place. So now, when you are entering, you are now rubbing something. You don't know how the concussion is. My guy with the water. So the blood vessels there will absorb it.
Just what's near the case?
What's the total system of the person?
Too bad.
So you now need to do investigation. If you are full block out, if you are of bacteria, neutrophil, and they high, good enough. Our in the laboratory area, we are trying to strengthen where we could actually diagnose those severe sepsis, like full block out or blood culture, or any other wound in the body that could be. You can swab it and culture it in order to diagnose it. So
you guys are doing a lot in the health sector.
It's something that we need the media to. When you're sick, you go to. We are unaware. We are not unaware of some facilities that don't give the required or desired service to our people. We are coming on monitoring them, accrediting them, and revalidating their certification to practice as hospital in the state.
All right.
Thank you so much.
Thank you very much. I think we'll have held our viewers spellbound. That's why everybody's listening instead of contributing. But that's okay. Thank you very much for coming today, Dr. Afam Obidike. You may want to advise our people just in a very single sentence on what to do.
Okay, thank you so much. Anambra, the monkeypox and the panic. Our governor, Professor Saludo, the hospitals are prepared in order to receive to treat or to manage the cases of that, and also to diagnose it. rashes na your body, mo ibo mazi mbo okay. Ega hospital, love na den. Enweku a place oya bo obo na ode and odo e wolu test again until result apota. A man for work e we make this test. That's the good news about it.
Very important.
So I send the result to apota awage. Then why that and now money is for other things that will make you to be alive. So all that to know when the state our governor for Charles Saludo has prepared for the state for any emergency outbreak. Thank you.
Thank you, sir. Thank you.
Yes, the by infection, it prevents from you'll be able to control the infection. Like when you know the preventive measures to put in place. Because the gold standard of every outbreak is infection prevention control. So the IPC measure of everyone, both in our household and everywhere in the workplace, because this monkeypox can still be passed through droplets. Like now we're sitting together, maybe I'm infected, God forbid, but I cough or sneeze, and you can pick it up.
So it's airborne?
Yes,
droplets.
Droplets, close contact.
Droplets.
That's why we're still when you are close to, if you wear mask, when you are close contact,
yes. Yes, I know in UK when the outbreak started,
maxing up again.
Yes, we get to do
well,
that.
when the thing started in UK, they tried enforcing that mask thing, but they had to stop it. Because that's because the other panic. They wanted to reduce the panic.
Okay.
So
thank you.
The goal side just infection prevention control, both for our health workers, household, and everyone.
All right. Thank you, Mr. Commissioner. Thank you, Dr. Anambra. Did I get that?
Okay.
Thank you very much for coming today. It's been a very long one, but I'm sure that it's very fruitful too. A lot of you that watched today, I'm sure you have grasped something that will, first of all, encourage you that you are being taken care of in this state. There's no cause for alarm. Okay? Thank you. Uganda.
Yes, we have to go, but we will not forget to also tell you that you need to be careful, prevent yourself. We understand that the COVID space is going away, but you know it's important that you still max up.
We're entering the fifth wave.
We are having
the fifth wave.
In COVID now.
Yes, now Biden is now.
We've entered the fifth wave.
You didn't hear that. I didn't say that. It's not going away.
They put the
I want to use this, please, if possible, to encourage people to receive their COVID vaccine.
But yes,
please. It's very essential.
Yes.
COVID is really increasing.
It's coming up again.
It is.
Please.
And I just spoke with my brother last night in America. He said that he and every member of the family had it, but the problem is that, I mean, the thing is that they've all been vaccinated.
Yes.
So that's why it's not fatal. Even the American president is down with, COVID now, but everybody has been vaccinated, and even with the booster. That's why it's not fatal again. So
all right.
Let's do the needful.
So please, everybody max up, take care of yourself, and stay out of trouble.
Oh, yes.
And this is exactly what we're drawing the curtains on today's edition of the program. Good morning, Anambra. I'm a berry. Ugonna.
And my name is Sijama Uche. See you tomorrow. Bye for now.